Did you catch this bit at Prime Minister's questions?
And it's not just waiting for a GP. It's waiting for all NHS treatment. Take cancer. For over a decade, waiting times for cancer care have been going up. His solution was supposed to be diagnostic hubs. The Health Secretary has been on a victory lap this week. But here's the rub, Prime Minister. Since they were opened last year, 135,000 extra people are now waiting for scans and tests. Can he think of a better way to describe soaring cancer waiting lists than wanting and inadequate?
Ooh, Sir Keir really laid one on the PM there, didn't he? But we like to dig a little deeper into the numbers here, and when we do, we turn to our stat man, formerly with the Office for National Statistics, Jamie Jenkins. Jamie, what do you make of Sir Keir's numbers there?
Yeah, evening, Mark. I think, first of all, it's good actually to see Keir Starmer actually tackling the Prime Minister with proper issues rather than just Partygate. It was what we've seen in recent kind of months. And he chose most of his questions today, Mark, to look at the NHS and how the pandemic has hit the NHS waiting times. Now, ironically, he would have probably voted for longer and more stringent lockdowns, which probably, if he had been in charge, probably would have meant that we'd had even worse things. But there was a few things I noticed in the discussion today, Mark, and he was factually correct on a couple of things. I'll touch upon those. So basically what the NHS is, they have targets to try and get people who have an urgent referral, say from a GP, because there's some suspected cancer, for them to start treatment if they do actually have cancer within 2 months. Now, the NHS have got a target in England to get about 85% of people to meet that kind of target of getting the treatment started within 2 months. And in 2010, and in the first 4 years of the coalition government and David Cameron, they met that target, and they actually have stopped meeting that target since 2014. It's been falling down now, and in the year before the pandemic, only 77% of patients were getting that referral and getting the treatment started within 2 months. Now, so he's right to say today, Starmer, that it's got worse over the last 10 years. Now, through the pandemic, Mark, what we also saw in the first year of the pandemic, the number of people being referred falling down, because obviously we were all told to stay home, protect the NHS and save lives, forget about yourself kind of thing in terms of getting checked. And in the 12 months to March, it's dropped down even further. 12 months to March this year, 2022, dropped down even further to kind of 67%. So you might think, OK, it'll all be brilliant under Keir Starmer. But what he didn't talk about, I'm surprised Boris didn't really fight back on this. Maybe he was caught unawares in terms of what Keir would ask questions is. So Wales, where I live, just over the border from England, the health is devolved across the country. And if you look at the 2 month referral to treatment percentage in Wales, it's much lower. It's at 59%. So under a Labour-run administration within the UK, that's the only way we can do the comparison. It's actually worse in Wales than it is in England. So I think Boris missed a trick there to probably fight back with that. But Keir really, if he's trying to imply that Labour would run things better, the facts over in Wales don't show that.
Yeah, we forget that these are essentially, although we talk about it as a national health system, there's actually an English, Welsh, Northern Irish and Scottish health system, and they're all run as essentially as four separate things, effectively. But these are pretty shocking numbers. If, as you say, in Wales, only 58.7% start their cancer treatment within 2 months of a diagnosis. That would be regarded as unacceptable in most other types of health system, in Europe or in the United States, whichever way you wish to go.
No, indeed, Mark. And the important thing really in this is, obviously, when somebody is told they've got cancer, they immediately think, oh, I'm going to be dying of all of this. But cancer survival rates do differ significantly for obviously different cancers. And that early diagnosis and that early treatment, so it's not just the ones that we've talked about here who are waiting to start that treatment within 2 months. We know there are people missing in the system because of the lockdowns and struggling to get GP appointments that haven't been coming forward. Because what we do know is that, say, take breast cancer as a good example. If you get early diagnosis, it's what you would class as stage 1. So that's very early. You catch it. That's why we have the screening programs. Almost everybody who catches the cancer that way survives for 5 years. But if he's caught late and you get delayed in terms of your treatment, what you would class as stage 4 cancer, which is a late diagnosis, just 1 in 4 people survive. And the UK overall, Mark, fares pretty poorly when you compare to some other countries as well. If you take lung cancer, outcomes for patients in the UK are far worse than Australia and Canada. So you're right to say that in any health system in the world, if you think there's 57% start in treatment, you're talking 2 months, but people probably, the day they diagnose, will want to start treatment the day after. Obviously, that's not possible. But comparable to other countries, the UK is pretty poor.
No, Rudy Giuliani, the former New York mayor who was on this show, has always said that if he'd got his prostate cancer diagnosis in the UK, he would be dead. He might be wrong about that, but that's certainly how he feels about it. Now, we've made everything worse, so that however bad the numbers were in 2019, they're way worse now because of the so-called Protect the NHS. What happened in northern Italy was that for the first 2 weeks of the COVID, the COVID hit and hospitals were overwhelmed, and 70, 80-year-old doctors and nurses came out of retirement to help out in the overwhelmed system, and they caught the COVID and they died. That was for 2 or 3 weeks. We are now 2 years into this thing, and basically the patient-doctor relationship, the access to hospitals has still not got back to normal.
No, Mark, and the Attorney General in Wales last week was talking about it may take until 2030, and it'll be similar in the other 4 nations across the country as well. It may take till 2030 to get waiting list levels back to 2020 levels. Now, if I was talking to you a couple of years ago about the waiting lists in the UK in 2020, they weren't very good then. And we had a report actually, Mark, out, not from a pressure group or anybody. This was the NHS themselves last week, and they were looking at outcomes for diabetes patients. And because diabetes patients weren't coming forward or getting the usual checks that they would normally get through the pandemic, they estimated more than 3,000 extra deaths of people who had diabetes because they weren't getting the 8 standard checks that they've got, more than what you would have expected during the pandemic as well. So, we're starting to see that big fallout. Obviously, it was all about COVID for the last 2 years, but all these people, remember, I think the more important thing I'd probably say to the viewers, Mark, is that we've heard protect the NHS, save lives. People really got to start protecting themselves and saving their own lives and trying to get those appointments if they've got any niggles or any problems. It's difficult to get these appointments, but just keep fighting and trying to get through, because we know there are lots of people out there. They may be on a waiting list now. There's many people out there, Mark, as well, who are not on the waiting list yet because they don't know they've got something wrong with them yet.
Well, the Protect the NHS thing, Jamie, was absurd fetishization. The idea that a backlog has been built up that will take till 2030 to clear is absolutely disgraceful. As you say, people have to look after themselves, because in the end, they're not sentimental about you. You sit there on the Zoom call with your GP while your stage 2 cancer metastasizes into stage 4, and you're done. So banging your pots and pans on your doorstep to cheer the NHS isn't actually going to do anything for health in this country. Thank you very much, Jamie. It's always good to see you, and we'll look closer at more numbers next time.